My name is Jennifer Spakeen, and I'm the Director of the Aging and Disability Resource Center here with Eau Claire County. Thank you for taking the time to view our resource video. We hope it provides you the information that you're looking for. Our ADRC provides services to older adults and adults with disabilities that live in our county. We also help those caring for individuals that are older or living with a disability, and professionals as well. We provide unbiased information and assistance, so if after this video you feel like you could use more information, don't hesitate to give us a call. ADRC services are open to anybody that is an Eau Claire County resident. There is no income requirement at all for our services, so please don't hesitate to give us a call. We hope you enjoy the video. Thank you.
Welcome to the Medicare.gov Plan Finder Tool video. My name is Jessica Smith. I'm one of the Elder Benefits Specialists at the Aging and Disability Resource Center of Eau Claire County. I'm going to be talking to you a little bit about the Plan Finder tool, which helps to compare your Medicare Part D options. The Plan Finder tool can be used for comparing Part D options and also comparing Advantage Plan options, which can include Part D coverage. The Plan Finder cannot be used to explore supplement policies. To explore supplement policies, you could talk with your insurance agent or meet with a benefits specialist at the ADRC. Before you begin using the Plan Finder tool, you might want to gather some information together. If you are already on Medicare, you'll want to gather your Medicare card and the information from that card, your zip code, your name and address of your pharmacy, and a list of your current prescriptions, including whether they are tablets, caplets, the dosage, and how often you refill those prescriptions. To find the Plan Finder tool, you will want to go to the internet to www.medicare.gov, and I will show you an example of how to use this tool. Let's look at the Medicare.gov website and the Plan Finder tool. Find the Medicare.gov website at www.medicare.gov. To find the Plan Finder tool, go to the green button that indicates Find Health and Drug Plans. On the Medicare Plan Finder, you can do a general search by zip code or a personalized search with your Medicare information. The personalized search will allow you to get more accurate results if you have that information. For the purposes of this demonstration, we will be using some test case information. So first I will enter a zip code and then a Medicare number. You can find your Medicare claim number on your red, white, and blue Medicare card. Enter the last name of the person, the month and year that Part A started for them, and their date of birth. And then click Find Plans. If you already have Medicare, you should be able to see a current profile, which will show your zip code, your current coverage, and current subsidy if you are receiving extra help. It may also show future coverage information. The next step of the Plan Finder is to enter your drugs. You can choose not to enter any drugs, or if you don't take any drugs, you can also click that option. For the purposes of this demonstration, I'm going to enter a test case list of drugs. You'll notice that under this drug, Crestor, you will find some options of the dosage, the quantity of the refill, and how often the drug is refilled. You'll also want to select if this medicine is picked up from a retail pharmacy or a mail order pharmacy. Note that for brand name drugs, there is sometimes a generic option. Your doctor may say that you have to take the brand name drug, so in that case, you'll want to click Use Brand Name. Generic in general is usually cheaper, so we'll see what happens when we use the brand name. So click Continue. So our drug is listed now down here. I will enter a few other drugs for the purposes of this demonstration. Once your drug list is complete, you can look at the Retrieve My Saved Drug List box. This will give you a drug list ID and a password date. You can use this number to go back into the Plan Finder every year to review your information, so you don't have to re-enter the drugs every time. You can also change the password date. It's often a good idea to change this to your birth date or the person's birth date because it's easy to remember that date. Okay, now if you are done entering your drug list, you can click My Drug List is Complete. Step 3 is to select your pharmacies. You may select up to 2 pharmacies. For the purposes of this demonstration, we will select 1. You can also select the number of miles outside of your zip code that you wanted to go. It's important to select the pharmacy that you normally use. Don't select a plan based on which pharmacy is preferred. Rather, select a plan based on the pharmacy that you prefer to use. We selected CVS Pharmacy, and so now we will continue to plan results. Step 4 is to refine your plan results. There are a number of options on the left-hand side of the screen. You can search by monthly plan premium, limiting your annual drug deductible. Select options for plans that have no restrictions on your drugs, have all your drugs on your formulary, or provide mail order pricing. You can select plans that have better star ratings. Again, that's the customer service rating. You can select plans that offer nationwide coverage or allow you to see your own doctor. You can select special needs plans if that applies to your situation. You can change your health status. That could affect the cost estimates in the results. And then you could select plans by company. For this demonstration, we will do a general search just of the Part D plans. This section will show you that you can select Part D plans with original Medicare, Medicare health plans with drug coverage, which are Advantage plans that include drug coverage, and Medicare health plans without drug coverage, which are Advantage plans without drug coverage. You can see that when we select Part D plans with original Medicare, there are 22 plans available in this zip code area. So now we'll click Continue to Plan Results. Under Plan Results, you'll notice these symbols. There are a few different symbols that might pop up. One of them is the star rating, and this little N shows nationwide coverage. You can skip over the original Medicare selection. That's your current plan. Now, the plans will be listed in order of lowest remainder of the year retail costs. You can also sort by overall star rating, lowest monthly premium, plan name, lowest annual drug deductible, drug restrictions, off-formulary drugs, and lowest remainder of the year mail order costs. So the top 3 plans will have calculated to be the lowest remainder of the year retail costs. You can compare up to 3 plans at a time. So we'll select the top 3 plans and scroll down to compare plans. This screen provides a lot of information and we won't go over all of it, but I will show you that these 3 plans will show the monthly drug premium, whether or not there is a deductible, and then it will go into the monthly costs. You can also click to enroll in the plan once you've decided you want to go with one of the plans. To look at the full cost, I believe it's easier to look at the comparison report. So you can scroll down to the Print Comparison Report. When you're customizing your report, you can select various options. One option is to show the mail order estimated costs, which can be interesting because mail order can sometimes be less expensive. When you're ready to view the report, click Print. You may be able to print the report from your computer if you have a printer, and if you do not have a printer, you can just view the report online. There's a lot of information online, and it will show you 3 different options that you chose. One of the most important boxes that you want to look at are the fixed costs. So this will show if the plan has a premium and whether the plan has a deductible. One of the boxes that you can look at to determine which plan is most cost effective for you is the estimate of what you will pay for your drug plan premium and drug costs at the pharmacy that you chose. So this will include the premium costs and the co-pays that you pay. So it really helps you to understand which plan is going to be the most cost effective for you. So with the drugs that we entered, it shows you the January enrollment, so that would be the cost for the entire year, including the premium. or the enrollment today, and that would mean for the remaining months of the year if you enrolled in the plan today. So when you look at this, you could see that the lowest cost plan for the entire year would be right here, the first option. But if you enrolled in the middle of the year because you had a special enrollment period, you would look at the remainder of the year costs, which this one then would be the lowest cost. The plan comparison report will also show you how the copays will play out throughout the year. There are 4 different coverage periods with Part D plans. There is a deductible period, an initial coverage period, the coverage gap period, which also may be called the donut hole, and then the catastrophic period. If you don't have a lot of medications, you may never make it to the donut hole or the catastrophic periods, but it is good to know this information. For the purposes of this demonstration, we used a brand name drug, Crestor, and you can see that the costs for that drug are pretty high compared to the other drugs. So let's go back and see what it looks like when we select the generic option. We're going back to change Crestor to a generic form of that drug. To get out of the comparison report, hit Escape. Now you want to hit Enter Your Drugs to go back to the drug list. To change a drug from brand name to generic, simply look at the generic options, and if it gives you a link to the generic, you just need to click on that link, and it will automatically switch it then to the generic form of the drug. You can also switch back to the brand name. You'll want to talk to your doctor, of course, if you are going to try to use a generic versus a brand name, or a brand name versus a generic. Once you're done, you can click My Drug List is Complete again. We've already selected our pharmacy, so we'll continue to Plan Results. We're going to select Part D plans with Original Medicare again, and we'll see if anything's changed. So when we look at the new comparison report, we can see that we changed the original drug, Crestor, which is a brand name, to the generic, and that has changed our plan results. Now we have 3 other new plans to compare. So those plans have calculated the estimated drug costs throughout the year, and if you would enroll now until the end of the year, just like the other comparison report we looked at. But as you can see, the costs are a lot lower. We had costs for the entire year in about the $1,000 range, and now we're in the $300 to $500 range for the whole year. And as far as if you would enroll in the plan today, you would only have $143 of costs throughout the end of the year, compared to, I believe the lowest was $603 and with the brand name. So the generics usually do cost less overall. Now, drug costs can change depending on pharmacy, depending on the plan, depending on dosage. So there are a lot of variables, and that's why it's really important to make sure you enter the correct drug information and pharmacy information when you're comparing the plans. So, and also remember that the drug information is pertinent to the year that you're looking at. So these plans change every year in around September or October. Usually by the beginning of October, the plan finder is updated with the new year's information. You're normally able to then look at the current year if you need coverage throughout the end of this year, or you can look at the options for the following year. Now that we've looked through an example of how to use the plan finder, we'll want to remember as we're looking at the different plans to consider a variety of factors, not just the cost of the premium. You'll want to look at the overall cost, including the monthly premium, deductible, co-payments or co-insurance, and the plan formularies to make sure that your prescriptions are included in the plan formulary. Don't worry too much about future prescriptions, but think about the prescriptions that you have at this time. Because remember, you can look at this plan every year and change it if you wish. You also want to look at the suitability of the plan. Look at the preferred pharmacy and make sure your pharmacy is preferred in the plan. Look at the mail order options if you're interested in that. Look at the drug restrictions or quantity limits, and also the star rating. Medicare will include that star rating, which is, in general, the customer service rating of the plan. Remember, each year, you'll want to look at your Part D options. The Part D plans change every year. You should receive an annual notice of change once you are on the plan. The open enrollment period is between October 15th and December 7th every year. To review your Part D options, talk with an insurance agent, use the Plan Finder to compare your own options, or meet with a benefits specialist at the ADRC.
Hello, my name is Emily Gilbertson and I'm the ADRC manager. I hope you got the information that you were looking for from our resource video. If not, or if you have more questions, we encourage you to call our office or stop by and set up an appointment. We also can meet with you right in your home. ADRC staff are available and excited to help you. Please contact us at the information provided to you on the screen.